what insurance companies do basically, they will create a value for their insurance, for their products. So how they create the values? So first one, creating values, yeah. So they will gather a large number of people and try to sell them their insurance. It can be individually they gather them, it can be they go to an organization and give them a group insurance. But they have to gather a large number of people because it's a risk pool. If we are 10 people here, 9 of them are absolutely fine. I have fallen sick. All 10 are paying their insurance. I don't know, who is falling sick. I fell sick. I went to the hospital. They are all health insurance premiums are taken together to pay for my, for my treatment. So it's known as a risk pool. If they cannot gather a lot of people to cover my insurance, then they are not really, doing a sustainable business. So they have to cover a lot of people so that the percentage falling sick is lower, and as well as they have enough capital to pay for a particular person's morbidity or disability, and they also have their operating costs. So we'll come to that. The second is, after gathering these people, they collect their money in terms of the payment, premium. They collect their money and then pay the indemnities when I will define what is indemnity. Pay indemnities when health issues arise. That is the amount they are supposed to pay. These health insurance companies are supposed to pay for this, for the patients, or those patients who certainly have the insurance with that particular company. Now, the premium they estimate is equal to the expected payout plus loads. Now, loads are nothing but the operating cost of the health insurance company. Now, what is this operating cost? They don't only, if they collect say 1000 rupees from me, 1000 rupees from 9 other people, so total 10,000 rupees. And if I am falling sick, they cannot give me all 10,000 rupees, right? And because they also need to pay the salaries to their employees. They also need to pay for the rent for the building, electricity, transportation, all other things, So these all other things are known as loads, expenditure towards the operations, so the operating cost. And the expected payout are the payout towards the insurance claims, because I claim my insurance back when I am sick, right? So the expected payout is the total payment they will make against the claims which have arisen during a particular period out of their customer base. So this expected payout is, they can expect, okay fine, this is this person Angan who has to pay 10,000 rupees, who has to, who will claim an amount of 10,000 rupees. There is somebody else ABCD, they may also claim 5,000 rupees. So if my expected claim is higher, I will charge the insurance premium higher, because now we 2 out of 10 will ask for 15,000 rupees and the insurance company cannot keep 1,000 rupees, because if they expect us, we don't ask, different story altogether, but they expect us that based on our profile we can ask for a payment 15,000 rupees, but they are only collecting 10,000 rupees, so they may go into a trouble, a loss making business. So they have to understand that what is their expected payout, on top of that what is their operating cost, right? If it is just me 10,000 rupees and then they have charged all 1,000 rupees from 10 people, and then I ask 10,000, they are giving me all. Now, if in that way they are collecting a premium of 1,000 rupees, so 10 people are paying a premium of 1,000 rupees. and total is 10,000 rupees. Yes, and then that should be added with load, which is 2,000 rupees, right? And that is how they can collect 12,000 from 10 people and can ask for a premium of 1,200 rupees. We will discuss this again in detail just 5-10 minutes after, 5-10 minutes later. So when we are talking about insurance, there are four things we must remember, in terms of when we are buying an insurance. The first thing is, what is an insurance? So the insurance is a contract or a piece of paper, which offers a contract between the patients and the health insurance company, which offers the following. So the contract is between the patient and the health insurance company. What is the following? That the insurance company will pay 1 minus C% of 1 minus C%, that means not 100%. What is this 1 minus C%? I'll tell you. Of qualified medical expenses, which can be denoted as X, which is the total expense incurred during a time period. Now I'll go one by one. Yes, 1 minus C%. This C is known as the co-payment. This C is known as the co-payment. Co is together again, co-payment. Now what is co-payment? When there is a claim from the patients to get that insurance money back because they are sick, somebody in that family household or that particular individual is sick. When there is a claim, the proportion of the claim paid by the patient is the co-payment. That means this is the C percentage, right? This is the C percentage, and this C percentage, if 1 is 100, so if the patient is paying 20%, then this is 80%, which the insurance company is supposed to pay. Yes, so that means the insurance company is not going to pay the entire amount. In some cases it is 100%. In some cases it is 100%, but not all, often because certain things, say ambulance, the medicines, they are not charged. I mean, they are not covered, right? That the patient has to pay. Or some medical appliances, say this a wheelchair or a stick, all this, the patient has to pay. So this is what the insurance company will pay of qualified medical expenses. Now what is this qualified medical expenses? In that document, the contract, it clearly mentions which are the medical expenses will be covered, which are the diseases will be covered, how far it will be covered, whether pregnancy will be covered, childbirth will be, or a delivery will be covered, whether my my eye problems, optometric problems will be covered. So it clearly mentions whether my dental problems will be covered. So only that 80% of those which is qualified in my insurance will be incurred during a time period of in 1 year. Yeah. So what this the insurance contract says, and then I need to pay a certain price for that, and then that price is known as premium. To get that contract, I need to pay a price per year. So this price is known as the premium, often given as in terms of P, which is paid by the consumer it's not right to write patient, because they are not patient all the time or most of the time when they buy an insurance. So paid by the consumer, price be paid by the consumer when they are purchasing the contract from the insurance company. Yeah, when they are purchasing a contract. And then we have discussed about this indemnity, right, over here. Indemnities. Now what is this indemnity? These indemnities are finally what the insurance companies are paying. They are paying 1 minus C%, right? So indemnities are the total amount the insurance companies will pay to the healthcare provider or to the patient, pay to the patient or healthcare provider. Yes, and it is 1 minus C% of the total expenditure X. That is the total medical expenditure, right? So this is what? This is the 80% of the total medical expenditure what they have to pay, the insurance companies have to pay. That is the indemnity. How they estimate the revenue? The revenue for an insurance company is estimated in terms of, this is again my income minus my costs, right? So if my income or my revenue, my revenue is the, so this is the profit, sorry, the profit is the revenue minus cost. So if my revenue is summation of all the premiums, right, that is my revenue, that is my earning. Even those who are not falling sick, they are paying me the premium. So this is my revenue, and the expenses is summation 1 minus C into X. Why summation? It is, say I have asked for 10,000, somebody ABCD has asked for 5,000. So this is my expenses. So this revenue minus expenses is my profit as an insurance company. This is my profit or earning. Yeah, the insurance company will go bankrupt if they are paying more. So this is more than the premium. So if the indemnities or the expenses what they are paying for say 5, 10, 15 patients is more than the total premium they are earning, you know. So for say out of 100, 90 may not ask for any indemnities or any claim, 10 have asked for the claims. So the together all these claims, if it is more than the premium, total premium they have earned from all these 100 people, then the insurance company will go bankrupt because they are making losses. There comes the idea about actuarially fair premium or actuarial fairness. What loosely we discussed just few slides back. Actuarial fairness. What is actuarial fairness? It is defined in terms of actuarially fair premium. Actuarially fair premium. Now what does this means? This is the average value of indemnity payments, average value of indemnity payments for a population of N, which is their customer base, population of N or of N insured people, which is their customer base, right? So this is nothing but total indemnity. So your average value is nothing but your total indemnity of that particular, so it is nothing but the total indemnity divided by total number of people, insured people. Yes, so your total indemnity is summation 1 minus C into X divided by N. This is my average indemnity, right? And if that insurance company charges this actuarially fair premium, then they are paying all their revenue out to meet the claims from the patients, and then they don't have any money to pay for their staffs. So therefore, this actuarially fair premium is very, very risky, because then in this case your P is this, the total payment you are making for the treatment divided by the total number of people, and this is summation P, which is like Pi into N, all these summation Pi into N, all these individuals together. So that means this total P should be more than the total premium, should be more than the total indemnity, and that is where they will not go bankrupt, right? If this summation P should be more than 1 minus Cx, and if 1 minus Cx by N is more than the individual premium, if we are estimating this individual premium based on total expected payout divided by the total number of population, that is average expected payout, then I am not actually accounting for the payment for my staffs. Therefore, we have to keep in mind what is the load. So when we are estimating the premium, that should be expected payout plus loads. That is the amount we are giving to the for my operation cost, towards my operation cost, so, and you can keep them together and divide it by N. That should be my actual premium. Yeah, otherwise I may run into losses. How I can estimate the actuarial fair premium in terms of probability? Because when we talk about expectation, that is actually expected payout, that is actually based on the probability of a person of falling sick, right? A person falling sick will have, the higher the probability of a person falling sick, will be higher my probability to pay for that particular person, and lesser the probability is closer to 0, that means that person is doing quite well, he is like, his background says he is physically quite well, so I am not actually going to make a payment for this person during next 1 year. Yes, so, and we never say that that is 0, but close to 0, low or high, so it's not certain or it's not uncertain, anything. So when we estimate the actuarially fair premium in terms of probability, we must take into account the probability of falling sick. Which should be multiplied by C, which is cost of sickness or of that illness, of that particular disease, cost of treatment. So you can actually then actuarially estimate this actuarially fair premium as a product of the probability of falling sick multiplied the cost of that treatment for that particular disease, and an insurer needs to estimate this PS into C for every individual customer they do have. Yes, and then take an average to get this actuarially fair premium, because this is an average estimate. This is a premium for one individual. This is not the total, right? So every individual has a probability, different probability, from for falling sick, and based on those probabilities they have a different estimate or expected cost to be paid. Multiply that, that is the payment you are going to make for that particular customer. Together you get the total expected payout. Again, total expected payout, not load. So whenever you are not estimating load, it just gives you the actuarially fair premium. So again, as I said, so your total premium, actual and actuarial is it's a part of, it's a subject, it's a discipline of mathematics and statistics, which basically deals with the risks and uncertainties, probabilities. So here they are understanding the risk, they are studying the risk of a person falling sick, or the studying the payment and insurance make based on certain parameters, certain probabilistic nature of certain parameters, certain variables. And that is why they have given it a name of actuarially. But when we estimate not actuarially, RIA is not there, just actually. So when I estimate the actual premium, we must take actuarially fair premium plus load. If we don't account for the load, the insurance company is going bankrupt. Yes. So therefore we need to keep this, do this estimate, and then try to understand that what is the load. So this is the load which we estimate with this actuarially fair premium 10,000, or the premium I am getting, expecting a expected payout of 10,000, which comes from the this PS into C. This is nothing but the PS into C. And if you have got that, if you have got this value, just add 2000 with this, and then you get a total expenditure what as an insurance company you are going to incur during a particular period of time, divided by this N, which is the number of insured patients, insured customers who you have covered, and this is your actual premium. Your actuarially fair premium is 1000, your actual premium should be 1200, considering 2000 rupees as the load. Thank you.